Same things, obesity and cardiovascular disease. Cardiovascular disease relative risk of is increasing actually when you have a patient with high body mass index. How does obesity cause cardiovascular disease? So we know it's a risk factor of cardiovascular disease, but how does happen this? So basically, we need to know that there is a pattern of body fat distribution between men and women. So usually in men you see intra-abdominal visceral type, or what we call it android, or apple-shaped. And in women you see lower body or external type, or beer-shaped. By CT scan, they did a CT scan and they found that a patient with obesity, let's say body mass index is around like 35, and someone with normal body mass index, they found that visceral type in this one, as you see, is higher than the normal person. And then they did the studies on that, as we see why this patient has, let's say a male patient had visceral type, and why this woman, she had what we call it lower body obesity. So they found that all fat cells are equal between male and female, but they found that it's actually with male, what we call it visceral obesity, large insulin resistance of adipocytes, increased androgen. The other things is insulin-mediated adipocytes. Also, they found that it's increasing the catecholamines, and this will lead to increasing the process of lipolysis. At the end of all these things, it's increasing fatty acids, and that's what give us central obesity or visceral obesity. In female, they found that small insulin-sensitive adipocytes, and this actually lead to decreased androgen, and this lead to increase the fatty acids. So here, body fat distribution, as I mentioned before, between male and female. Men are actually develop visceral type obesity, as I mentioned, while women develop peripheral type. Androgen appears to influence this distribution. Polycystic ovarian disease or syndrome with androgenemia is another risk factor for visceral type obesity. Steroid and growth hormones also, they found that it's tend to develop visceral obesity. Regarding cardiovascular disease, how obesity causing cardiovascular disease. By looking here to abdominal, let's say a visceral type, a male patient with a visceral type obesity, this will lead to lipolysis, and this will decrease the sensitivity to insulin. This will lead to increase the free fatty acids, and this will act on the pancreas, liver, and blood vessels. So for pancreas and muscles, this will lead to insulin resistance, which causing hyperinsulinemia and type 2 diabetes. In the liver, this will lead to increased LDL and decreased HDL. And in blood vessels, this will lead to hypertension by increasing hypercoagulable state and causing endothelial dysfunction. All these factors, it will lead to cardiovascular disease. Here is the most important things or factors, what you call it, adipose tissue. Adipose tissue, it's an inflammatory factors lead to increasing and releasing of interleukins, especially interleukin 6. Here is the same like what I mentioned, the CT scan. They did CT scan. They found that when the visceral adipose tissue volume is increasing, this will increase the comorbidities, and it will increase the cardiovascular disease.